I would like to welcome you all to the 2020 Joint Public Health Annual Conference. This event gives us the opportunity to raise the profile of public health research, interventions and innovation, and allows professionals, practitioners and researchers working in public health the chance to actually come together. This sharing of ideas and experiences is ever more crucial given the current global pandemic. The spread of COVID-19 is one of the biggest public health challenges we have faced, and research plays a key role in the fight against it, because the impact of COVID-19 and the pandemic has been felt by us all. It has also highlighted the stark inequalities that exist in our society. These inequalities unfortunately existed long before COVID-19. It is a hard fact to hear that people living in the most deprived areas of Northern Ireland are at higher risk of infection from COVID-19 than those living in the least deprived areas. And COVID-19 has had a disproportionate impact on people from the Black, Asian and minority ethnic backgrounds. There's an urgent need, therefore, to gather evidence that will inform national policy and practice and enable new diagnostic tests, treatments and vaccines to be developed and tested for COVID-19. It is vital, I believe, that we secure a safe and healthy future for all citizens of Northern Ireland, regardless of age, gender, race or socioeconomic status. There is a growing evidence base that shows research-active healthcare organisations provide better outcomes for their patients. To ensure our citizens have access to the best evidence-based healthcare and policy-informed practice. Finally, it's important that I recognise the enormous effort that has gone into COVID-19 and the response in Northern Ireland. I've been personally overwhelmed by the response of our health and social care professionals who have risen to the challenges presented to them. Undoubtedly, we will continue to learn from the experiences of managing the pandemic, and this will afford us the opportunity to explore how the pandemic has actually impacted our citizens. I join my colleague, Minister Stephen Donnelly, in wishing you all well for the conference today. Thank you.
Colleagues, I would like to welcome you all to this year's Joint Public Health Conference. I'm delighted to have been asked to open the conference alongside my colleague, Northern Ireland's Health Minister Robin Swann. Today's conference builds on the existing and long-established North-South cooperation to promote the health and well-being of the population right across the island. It will strengthen all our efforts to respond to the range of very serious challenges presented by COVID-19. As we all know, this is a global pandemic. It knows no borders. This is why I'm so glad to see the ongoing collaborative work of my department, their agencies and their counterparts in Northern Ireland. This cooperation is reflected in the Memorandum of Understanding drawn up and signed by both jurisdictions. We face a common challenge. It's essential that we continue to do everything we can across the island to not only fight this pandemic, but to build back better and stronger. Today's conference brings together stakeholders from the broad field of public health across the island, the UK and globally, who are playing a key role in the fight against this pandemic. And I want to thank you for all of your efforts. You're building the science, solutions and solidarity that we need if we are to achieve the best possible outcomes for our citizens. While we have all been impacted by COVID-19, we know that this pandemic disproportionately impacts those who live in our most deprived communities. The evidence is clear. People who live in disadvantaged communities are at higher risk of infection than those living in more affluent areas. They are also more vulnerable to other health, social and economic impacts of this pandemic. One of the cornerstones of the Healthy Ireland framework is inclusion and reducing health inequalities. A healthy population is an asset to a society, and we must promote an economy of well-being. By building health equity and giving everyone a chance to reach their potential to live a healthier life, we can reduce this inequality. There is now a real opportunity to create a healthy and equitable recovery from COVID-19, which makes us more resilient into the future. We can and we will recover. We will make it through this difficult period together. During today's conference, I welcome the discussion and sharing of ideas and knowledge as how to make this possible. Thank you.